feeding the senior horse and also feeding for a couple of conditions that are commonly seen in our senior horses, or conditions that are actually oftentimes ignored because people think that their horses are just getting old. So we'll start out with the normal feeding of the adult senior horse. And this is my 25-year-old, which we consider senior, my 25-year-old Andalusian Sirocco. And he will hopefully be standing here for the entire video, otherwise I'll have to tie him up. So when we have our older horses, it's often thought that we need to be completely changing the diet around, and that's not always the case. I have always fed our seniors the same diet that they had growing up. You know, from 3 years old on, they can be fed the exact same diet as long as there's no negative changes seen. So what changes are we going to see? Well, first and foremost, it's oftentimes weight loss. And the weight loss can be caused by problems with the teeth. So most vets, equine dentists, and professionals out there will often recommend that horses, especially senior horses, are done at least once a year, if not twice a year. And the problem with this is that every time, depending on the dentist, now it depends on the dentist or the vet that's doing the floating, they are going to be smoothing out, possibly grinding down tooth surface with every float. And the horse only has so much tooth coming out. You know, they're continually growing, and once they're out of tooth, they're out of tooth. So what my dentist commented on when she was here, not last year, but the year before, was she was really impressed with how much tooth Sirocco had left. And that was because I have not had Sirocco done every year. We've kind of gone back and forth. I think we went 4 years without a float one time, and now we're probably going to go 2 or 3 years without a float for him. Not just because of that reason, but also because he has a hyoid condition that makes it quite dangerous for her to be working in the back of the mouth. So it's important to know your dentist, and it's important to know their expertise level and know that they are not going to be taking off more tooth than they have to. Also, you don't want to err on going the other direction and not having your horse's mouth checked often enough. So again, it's coming down to really knowing your professional and trusting your professional. So some of the problems with teeth and the loss of surface to be able to chew, you can see some outward signs. And one of those signs is when a horse is quitting, Q-U-I-D-D-I-N-G, quitting the hay. And that is when you'll see pockets of grass or hay that they've had in their mouth and they've softened up. And they keep it in their mouth, and it's kind of almost a protective mechanism for them to be able to protect from the sharp molars or the sharp points in the back of their mouth. So you'll see them for various reasons, not only protective reasons, but also just lack of ability to chew. You'll see these piles of wet grass or hay falling out of their mouths. And so whenever you see quitting, that's always going to be a sign to have your dentist or your vet look at the horse's mouth. Another obvious sign is going to be weight loss. So weight loss can be due to the teeth, or it can also be due to just simply using poor feeding choices. There are a lot of senior products out there these days that are kind of like, it would be like feeding your grandmother Twinkies. They're using very, very poor carbs. They're not healthy protein. And with those products, you tend to see loss of top line on the horse, going from the poll back to the croup of the horse at the tail. You can see just overall lack of muscling, and kind of a bloaty look to the stomach, where the stomach isn't necessarily, the ribs aren't showing, but it's just not a healthy protein. It's not a healthy look to the horse. And so you have to be really careful with what you're feeding to make sure that you've got a quality protein We always recommend low sugar, low starch, high fat. You can feed high fat to a senior unless they're very overweight, then you've got to kind of monitor your amounts. And there are better, choices one over another if you've got an obese horse. So once you've got your floats on target and you've got a really good feed going in your horse, which hopefully you had throughout their adult life, you're not going to really see many other changes going on with the horse. They do have a compromised immune system at that point, and so it is extremely important to be feeding a good chelated mineral, because the chelated minerals are going to be much more readily absorbed in the body, and you're not going to have the interactions that we see with synthetic minerals. There are synthetic minerals out there. They're cheaper. They're seen in most all of the big company mixes. But what happens with those is there's a lot of reactivity in the body that happens when those minerals break down. And you can have toxic buildup, which can also lead to arthritis and other pain situations in the horse where these minerals have built up. So it's very, very important to use a chelated mineral, a very well absorbed product that has a good level of vitamins and minerals for your senior horse, and that is going to help keep that immune system going as they're aging. Now, if you have an adult horse who's in his teens and you're not seeing any negative changes, if it ain't broke, don't fix it. You don't need to make any changes. It's only if you start to see weight loss, as I say, the tooth problem with quitting the hay, not able to chew, or if you see some distinct personality changes, or lameness issues. Oftentimes, again, if they're on a poor mineral mix, you can have lameness issues showing up and arthritis showing up. So just keep your eye on your horse, and if they're doing well in their teens and they're on a good vitamin mineral and a low sugar, low starch, high fat product, you should be good to go through their senior years. Now, a couple of situations and conditions that we see as horses age, or even can be seen when they're young horses, but oftentimes when these are seen when the horse is over 15, these conditions are often overlooked. And people just think that my horse is getting old. You have a 30-year-old or a 35-year-old horse and they start showing these changes, everyone is going to think that horse is just old. It's normal. So it's really good to be on the lookout for these things and to be, to know what you're doing with the diet and so forth. So the first one, which is, they say that approximately 25 to 30% of horses over 15 will develop Cushings. You've heard of Cushings in dogs probably. So Cushings is also known as PPID, or pituitary pars intermedia dysfunction, PPID. Pituitary being the gland that lies at the base of the brain and that is responsible for controlling the endocrine system and the hormones that are released. The endocrine system is the hormones that are manufactured and released into the blood. So there are a couple different causes of Cushing's, and they both have to do with the hormones. One would be a tumor on the pituitary gland itself, and it's often found on the middle portion of the gland, and that's where the intermedia in the PPID comes from. And if there is this tumor that grows and puts pressure on the gland, there is going to be an increase or a dysfunction of these hormones that are released. And first and foremost, it's usually cortisol. Cortisol is the stress hormone. So cortisol is the hormone that we try and avoid when we have a horse that has laminitis. We talk about not muzzling the horse or not putting the horse into a real stressful situation. Also trimming. When a horse is trimmed and they take the heels out of the horse and they're causing a lot of pain for that horse walking around, that stressful, that cortisol is going to be released in higher amounts. So Cushing's is thought to be caused, one of the biggest causes of Cushing's, although they will say they don't really know the cause, but one of the causes that's talked about is increased levels of stress. And so we can see the increased levels of cortisol released when we have the tumor and it's putting pressure on that pituitary gland at the base of the brain. And the other thought is that there's simply dysfunction of the endocrine system. And we have some flies here that are going through, we're actually in a very, we got a really warm day today and the flies have not been out. We had 6 inches of snow not too long ago and now the flies are out today. So anyway, so Cushing's, again, is something that is not highly unusual and a lot of people mistake it for old age. The symptoms with Cushing's are often going to be a long, shaggy, curly hair coat that's very slow to shed, increased thirst, drinking a lot more water, lethargy, just an overall, sometimes laminitis, overall body condition, maybe an obese horse. Obese horses do tend to be very prone to Cushing's because there is also a relation between insulin resistance, or IR as we call it, and Cushing's. And IR is often an obese horse. So Cushing's, again, you would be looking for that long, curly kind of hair coat. Some of you have probably either have horses like that or you've seen horses like that. It just looks really shaggy and messy and it doesn't shed out. When it does shed out, oftentimes it kind of comes out in clumps and the horse just looks horrible in the spring. So that's one of the biggest symptoms and one of the most easy to recognize signs. Not all the signs are going to be that easy to recognize, so you have to really, it's a good idea to simply feed to prevent these things. So when we're trying to prevent Cushing's, what we want to do, as I mentioned, there's an increase in cortisol, the stress hormone. We want to try and keep stress at a minimum. And that means paying attention to our vaccinations, not over-vaccinating the horse. Only do what's absolutely necessary. We do not vaccinate here. My horses don't go anywhere. They're not seeing other horses here. We're not in any kind of a high-risk environment. And we'll do tetanus every 3 to 5 years, and that's the only vaccine we give here. But if you're in a high populated area or you're going to shows a lot, you're going to have requirements. You're going to have vaccines. So it's just a good idea to really know what you're doing. Don't overdo it. I like Dr. Madeline Ward. Dr. Madeline Ward has a lot of really great suggestions on vaccines, which ones are necessary, which ones you should avoid. So I would recommend Googling Madeline Ward vaccines or Dr. Madeline Ward's vaccine protocols, something like that. And you can usually find her up-to-date recommendations on vaccines. So keeping vaccines at a minimum, keeping chemical daily dewormers are a no-no. Do not, or try to avoid giving any kind of a daily dewormer. You want to be using chemical wormers when they're needed. We do chemical wormers here, Equimax, twice a year in the spring and the fall, but you definitely don't want to be overdoing chemical dewormers. So keeping vaccines at a minimum, keeping chemical dewormers at a minimum, no daily dewormers used, and in your environment and your management with your horses, always making sure that your horse has company. Make sure that your horse is turned out as much as possible. At a minimum, 6 hours a day. I mean, it's best if you can go 12 hours a day or even 24/7 out with a shelter. That's always going to be the healthiest environment for a horse. So really keeping your horse happy, low stress, always having hay in front of it, grass hay, even if you have to use a slow feed net feeder, like I have to do with these Easy Keepers, just really keeping them at low stress. And the other thing is, when you're feeding, you want to be feeding, as I mentioned, low sugar, low starch, really high, well-absorbed vitamin minerals, and good protein. And for a senior horse, we're going to be striving for 12-13% protein. We use Dynamite TNT, Total Nutritional Treatment. Dynamite TNT and their Dynamite Hess pellets, high energy supplement. It's not a high energy supplement, but what it is it's a high protein, high fat, low sugar pellet. It's used for horses that just need extra weight. So instead of using a poor choice like pouring in canola oil or taking something that's really highly sprayed with pesticides like rice bran or something like that, the Dynamite Hess pellets are a really good option. But any kind of a really low sugar, low starch, and we always say low NSC, non-structural carbs. You want to be looking for a low NSC product. If you can get something that's below 10%, that's really good. Some products are even as low as 8%. So keeping your NSC low, feeding a nice high protein for your senior, and a high fat if they can tolerate the calories, and that is going to probably help you avoid Cushing's. The other part of this that's really important is exercise. So you want to keep that cortisol low and not traveling through the bloodstream. And one way that you can do that, and you can have these carbs burning faster, is by exercise. So the more often your horse can either be worked or be turned out, that's really critical. At the same token, you don't want to be overworking your horse so that he's stressed from too much work. So free turnout, maybe exercising for 30 minutes 3 times a week. That's just a rough idea, suggestion. And then following those diet guidelines, and that will really help you avoid problems with Cushing's. Now, there are a couple drugs available for Cushing's, and there are also a couple diagnostic tests that are available. Now, these diagnostic tests, one is called the dexamethasone suppression test. Dexamethasone is not recommended for horses because it can cause laminitis. And the dexamethasone suppression test can be harmful for your horse. So I recommend trying to avoid that. The other test, which is a ATCH, ATCH level test. I don't remember the exact terminology for that test, but both of those tests have the potential to harm your horse. So there are a couple products that you can use for this, a couple drugs. One is called Presend. The other is called Pergoglide. I think Presend contains Pergoglide, or Presend is the new name of Pergoglide. I don't really know the details on that. However, I do know that these products can have very negative side effects. Yes, they do work for some horses wonderfully, but they also do not work for others. So it's really best to just feed your horse properly to start with and avoid these conditions, so you can avoid those diagnostic tests and you can avoid those drugs. Now, another condition that we see, and that this has been going on for a long time. I remember when I first got in horses, or I can remember about 25 years ago, we all were hearing about EPSM, equine polysaccharide storage myopathy. Nowadays, they call it PSSM, polysaccharide storage myopathy. The EPSM, or today PSSM, there's 2 different forms, PSSM1 and PSSM2. Polysaccharide storage myopathy, in layman's terms, means simply that there's dysfunction within how the carbs are stored within the body. So carbs are metabolized into glucose. Glucose is used for energy within the cells. Any excess is going to be stored in the liver and the muscle cells as glycogen. If there is some, and then that is also going to be used for energy. If there's some disruption in this process, that is referred to as EPSM or PSSM. The difference between PSSM 1 and 2 is that the 1 is caused by a genetic factor. There's actually a gene that regulates for this. And PSSM2 is not related to the genetic code, and they don't really know the cause, but it's going to have the same symptoms, often the same kind of treatment and the same kind of prevention. So the symptoms in these conditions are going to be related to how the horse is storing the glycogen. There's going to be a lack of that energy. So that glycogen or glucose that was going to be used for energy is not going to be available in the proper way that it should have been. And there's going to be a lack of energy, a lack of muscle building in the horse's body. So oftentimes we see horses that are reluctant to move. They're reluctant to get up once they're laying down. They tie up. They have very, very firm muscles, much firmer than they should be. You know, muscles should be nice and soft and pliable. But if you have a horse that you're massaging, for example, and the muscles are just really, really rigid and firm, that can be one symptom of PSSM. Other symptoms, there's such a wide variety of symptoms that go along with this condition that you would not even think would be related. Laminitis, colics, loss of condition, crustiness on the neck, abnormal deposits throughout the body. There's just a whole wide range, colic, of symptoms that can be seen with PSSM1 or PSSM2. So when these two conditions are diagnosed, PSSM1, as I say, was a genetic caused by a gene, and that one can be diagnosed with a blood or hair sample. The PSSM2, which does not have the genetic factor, has to have a muscle biopsy. And they're looking for damage in that tissue. So, or the glycogen level and the damage in the tissue. So, rather than having a muscle biopsy done, what you can do if you suspect these conditions is you can simply feed for it. Again, and we're going to be feeding the exact same way that we fed for Cushing's. The only difference is going to be we're going to be providing more fat for the horse. So something, you know, when this first came out, what they were recommending was feeding like cups, multiple cups of vegetable oil, or you know, corn oil and things like that. Now in the nutrition course you're going to learn that oil is not the best choice, but it's all about giving the horse the fat that he is depleted of. He's not able to produce the same way that he was before this condition. So you want to be feeding a really high protein, high fat, low NSC, non-structural carbs, low sugar, low starch, that's what non-structural carbs are, and exercising the horse. So you have the exact same preventative measures in the diet that you had for Cushing's, and the exact same preventative measures that you had for keeping a senior horse healthy. So it's all about really using the best products throughout the horse's life. And I highly recommend Dynamite for these horses, because we have had Cushing's horses and EPSM horses that have done absolutely phenomenally on the TNT, which is their total nutritional treatment, and HES pellets. And then they are on the regular Dynamite, daily Dynamite vitamin and mineral. The TNT includes the regular daily Dynamite vitamin and minerals, so that one is just inclusive. But anyway, there's a couple ways you can go with that if you decide to go with Dynamite. But otherwise, you know, there's other good lines out there too. But you want to stay away from the high sugar, high carbs, high, you know, no molasses feed, no heavy grain meals, no, I mean, when you look at some of the grain products out there that are really nice and clean, like let's say Crypto Arrow. Crypto Arrow is an excellent clean feed, but its base is whole oats. It's whole oats, black oil sunflower seeds, alfalfa pellets, timothy pellets, green peas, rose hips, and some other herbs. It's a very, very nice clean feed, and people look at it and they think, oh my God, it's got 28 non-structural carb level. 28 is very high, and so they immediately think, I can't be feeding a 28 NSC product to my horse. Well, if you're only feeding 1 cup of the product or 2 cups, like these guys get 2 cups a day, they actually all summer long, they all had 4 to 5 cups a day because their weight was down quite a bit from what they gain weight on hay here. They can be out on free choice pasture every day of the week and they will not gain, but as soon as they go on hay, they blimp up. And so they were on 4 to 5 cups of Crypto Arrow and my own mix also, which is kind of similar to Crypto, but I add different herbs. They were on that all summer long and looked fantastic. And now that they're gaining because of the hay that they have to have in our cold climate, I cut back the Crypto Arrow to just 2 cups. And then they get their Dynamite vitamin mineral product in the Crypto Arrow. So anyway, there's options out there for you. And if you have any questions, please don't hesitate to reach out to either Dr. Angelique or myself. And we will answer your questions. So I think that was it. And again, I hope you enjoy your day, and I hope this was really helpful for you and your ponies. Take care.